Mckenzie repeated lumbar flexions in lying and sitting. This is a good exercise for a stenosis in the lumbar spine. This type of problem can cause lower back and buttock pain. If the stenosis is severe, then the pain can also go down your leg or legs. It comes from the Mckenzie assessment and treatment philosophy. Undertaking this exercise, you need to have been assessed by a physiotherapist who is Mckenzie trained, as doing this exercise for the wrong problem can make things worse. This exercise is all about post-exercise symptom relief and what is known as centralization, which is when the symptoms move away from the periphery and closer to the midline of the lower back. If your symptoms increase more peripherally after performing this exercise, then you must immediately cease the exercise and consult your physiotherapist. Also, if you have any cauda equina symptoms, which include bladder and bowel incontinence, retention, urgency, and saddle anesthesia, then this exercise isn't right for you, and you need to see your physio or doctor as soon as possible. If you're unsure, then don't perform the exercise until you've seen your physio or a doctor. Lying on your back, bring both your knees up towards your chest, grab behind your knees and pull them up so you feel a stretch. Go as far as possible, then slowly lower back down. Perform 10 repetitions as far as you can on each rep. It can bring on worse symptoms during, as long as afterwards the symptoms either lessen or centralize. An alternative version is to perform this exercise in sitting. In sitting, spread your legs wide and hold under your legs and pull your body down as far as you can, then slowly raise back to the start position. Be careful with this if you have either high or low blood pressure. Perform 10 repetitions as far as you can on each rep. It can bring on worse symptoms during, as long as afterwards the symptoms either lessen or centralize. The frequency that you should do depends on whether your symptoms are above or below the knee. For above the knee, you should do 10 repetitions every 2 to 3 hours. For below the knee, you should do 10 repetitions every hour. Once your symptoms have disappeared for 3 days in a row, then you can wean the frequency down slowly each day until you stop the exercise. If the technique alleviates temporarily but doesn't have a long-term effect, then you may need to see a doctor regarding a nerve root injection.